Hey friends, Dr. Russ here. We've got a treatment video for you today of a session we did with Linda, who likes everything really gentle and really light. So how do you address and resolve a stuck neck without any thrusts or cracking? It's really quite simple. It takes about 15 minutes. It's very relaxing for the patient, really easy on your body, very effective. I think every chiropractor and body worker should have a way to address folks who don't like a lot of force used on their body. Hope you enjoy the video. At the end of this video, we'll link to a full body session we did with Linda a couple of months ago. And in the video description, we'll link to our full script dispensary and our members page. These are just a couple ways that you can support the work that we're doing if you like to. Thanks for watching. See you again soon. Linda, will you show us where you're feeling it? Okay, left upper cervical and down a little bit into the mid-cervical spine, and there's no arm pain. Okay, does it hurt to cough or sneeze? Okay, good.
It actually wasn't, it's like when I do neck rotations, I just can feel it. It's like it's binding.
Okay, it feels stuck.
Yep.
Okay, more stuck than painful.
Correct.
Okay, so let's go through a motion palpation of her cervical spine, starting from the top. So I want you to lean back. The chair will hold you. Good. And so to start, I'm going to feel for the movement of the occiput on C1. So it's just like this little tiny nodding movement like this. So the condyle of the occiput is like an egg, and the lateral mass of the atlas is like a spoon. So it's like rocking an egg on a spoon. And that's moving pretty well.
Yeah, it's a little tender.
You feel a little stuck on the right side. Okay. So let's check C1 on C2, and that's where the issue starts. So as I rotate her to the right, I want to feel separation of C1 and C2 on the left, and I don't. And as I turn her to the left, I don't feel it much on the right either. So we're going to have to free up C1. And with Linda, we don't want to do thrust. She doesn't like that. So we're going to be gentle, and we're going to find some less forceful ways to move C1. So just gently feeling for the side bending and the disc wedging of C2 through C7. As you can see, she's small frame. So her cervical vertebrae are like that big. They're tiny. And so there's not going to be a lot of force required, and there's not going to be a lot of movement between them. Can you take a nice deep breath? So as she breathes in, I'm feeling for elevation of the first rib, and as she breathes out, I'm feeling for that first rib to depress. And here on this left side, where she's feeling kind of bunchy and stuck, it's not moving as well. So we're looking at C1, first rib, and once those are freed up a little bit, we're going to want to do some gentle work to release all the myofascia in between those. So let's start with you on your back.
Okay.
So remember, gentle, incremental, and all we're going to do is really simple is mobilize C1 on C2. So I'm starting by moving her through the easy range of motion. C1 moves really well until about there. So I've got my middle finger here on C1 and my middle finger here on C2, and I'm feeling for relative movement between those two, and it glides pretty well until she gets to about 20 degrees of rotation. And so now the idea is I want to stabilize C2 with my right middle finger, which I'm tapping here, while I'm using my left hand and left middle finger to move C1 in rotation. And I'm not going to force it. It's called an induction, because we're just gently inducing the movement. And her body knows how to do it. And there's nothing in the way other than habit. So here we go. Starting to get a little bit deeper into like a little stretch now between these two vertebrae. You can feel that. Just doing great breathing. And nice deep breath. Simple. Easy movement. One more time. Good. And here it goes. It's starting to let go. Now we have pretty easy movement to about 45 degrees. Try to be mindful that her hair is up. Sometimes when your patient has a ponytail, it gets in the way a little bit. So I've shifted my focus a little bit here. I've got the upper inch of her SCM right in between my two fingers right here that I'm giving a little squeeze. So that might actually be at the root of the problem, because as that SCM gets short from a trigger point, it's going to pull and crowd CO12 right there and create restriction, usually between either C1 or C1 and C2. So kind of doing double mobilization right now, moving C1 and stretching that SCM. And that was a nice little piece, so let's give it a second here. Good. You're feeling a little easy. Yep, you're feeling that easier movement. And actually, we're going to about 60 degrees now, which is good. So I want to make sure she's nice and balanced. And I'm going to do more or less the same thing to the other side. So here is her mastoid process, the ridge of her occiput. So CO1 is right up under there. That's the SCM. That's that transverse process of C1 and C2. And as I rotate her to the left, I can feel, and you can probably see that that's moving pretty well right until there. And then things get a little stuck. Yeah. So just an easy, gentle induction, and she's participating, which is nice. Kind of her body is showing me where it wants to go. Are you getting any stretch on the left side here, Linda?
I don't know.
Nope. Okay, you would know because you'd feel it. So
nothing uncomfortable.
Wonderful. Good. Good. Nice. So easy, gentle, sustained pressure. We're not even really approaching the end range of movement. We're just approaching the joint as it glides, kind of using its natural articular glide and a sustained pressure along its natural articular glide to induce the movement that we want. So now we're coming a little lower. And remember, we found that first rib being a little sticky on this left side, and her scalenes here attaching C2-3 to that first rib is a little bit tight right there. So I'm going to use a little oil, okay? And we're just going to really gently work those. Anytime we're working in this part of the body, we want to make sure we're mindful of a few things. One is the jugular vein and the carotid artery, and then the neurovascular bundle. So because Linda's small frame, you can see right there, that's the neurovascular bundle right there. So that would put her anterior scalene here, middle scalene here, and you can see this middle scalene kind of poking out a little bit. So again, nothing forceful. That doesn't work with her. She's going to have a lot of patients who their bodies are going to guard against rapid movement and deep pressure, and you want to be able to work with those people. They need care too, and so this is a great example. So that's about as much direct pressure as I'm going to use. Feels right though. Right on her upper trapezius here. Good breathing. Yeah, really nice. And so again, her neurovascular bundle right there, I don't want to press on it directly, but I do want to see if I can induce any movement of that first rib. And there we go. So this pressure is really coming here, not here, because her neurovascular bundle is right there. And in case I wasn't clear, we don't want to press on that. That's nerves. Good. So we're getting a nice little mobilization here through her left clavicle and those upper ribs, and her head starts to move as well. Feeling really good. I think it would be great if we could get a little more motion through this section of her scalene right there. Orienting myself, I'm on her middle scalene around the level of C5. And again, we're just going to start to induce some rocking of that lower cervical spine and the normal associated movement of that scaling. The inferior, superior, inferior, superior. So I'm not working through firm barriers. I'm working with the natural glide of the tissues. It takes a little longer, but it's worthwhile. And on some folks, it's the only way you're going to get it done. So now I'm coming opposite as I'm side bending and rotating her head to the right. I'm lifting that scaling a little bit, stretching it from the superior end. So we're really working it in both directions here. Nice deep breath. Good.
Does it feel a little, I mean, it almost felt like it was a little tight in here.
Fun. Okay. So we're getting some that SCM upper trap temporalis muscle connection that we talk about a lot in our jaw videos. It's a very important connection too. So good. Really nice. Good. So let's look at the jaw. We're going to stay external here. Can you just clench a little tiny bit and then relax and then open? Good. And there's a little restriction to anterior glide of that left mandible. Yeah, it's good. So we're going to stay with the same strategy. Linda, you're going to open slowly and close. And as she opens, I'm using my hands to introduce and induce glide of the condyle of the left mandible. Go again. Open, close. One more time. Good. Good. And so here, from the very top of the mandible, where the temporalis muscle attaches, we're going to follow up through that tendon, mobilizing the skin and the very thin fascia. It's thin, but it's really important between the skull and the scalp. And the temporalis muscle that lives in there, it moves the jaw. It also moves the fascia of the scalp. And so when a lot of people hold tension in their scalp, that's the temporalis muscle. Folks who look at computer screens a lot sometimes have to hold their eyes like open, like this. And that's your temporalis muscle is part of what is doing that. Yeah, like you just did right there. So we get some shortening and overuse in there. And it feels good to release that. Nice. So now here, with my middle finger on the back in the occiput, where, yeah, I'm going to lighten up a little bit there. That felt a little pokey. But it's her suboccipital muscle that feels like is the next thing that is the most tight. So as you loosen up one muscle and fascial line, and something else will all of a sudden feel the tightest because it was like the second tightest. So you loosened up the tightest thing, and now the second tightest thing is the thing that you feel the most. And that's how these layers work, and that's how you have to work through it. And you don't always have enough time to work through the whole pattern on every visit, but you try and get done what you can. Great. Good. So gently from her mastoid to the sternum and clavicle there. And just give it a little bit of a gentle flush. Smoothing better there. Good. We see in our anatomy books that the insertion of the SCM is right here, but don't forget it blends with the fascia. The intercostal fascia, the sternalis fascia here, and the pectoral fascia here. So yes, where the anatomical drawings show things attaching is it's just the beginning of the attachment. And now just a little traction. This is really gentle. So here she is, neutral. Now I'm just engaging that first soft tissue resistance and then the second resistance right there. Could I pull more? Yes. I'm not going to. Just a gentle opening. Nice, easy, sustained, steady pull. That's like the opposite of a ring dinger. Feels good. Let's get just a little more direct, really gentle, right up under the occiput now. So I've got my 2 middle fingers and my 2 ring fingers. I'm going to show it's like that. And her occiput's just resting here on the finger pads so that the tips of my fingers are coming up and giving a little stretch to the suboccipital membranes and muscles. So right there. And just let your head be heavy, Linda. And we're just going to feel
just a little bit lighter. I think.
A little lighter?
Yeah.
Okay. So we're just going to feel that. How's that? Good. Nice. So make your head nice and heavy. Yeah. So I'm not pushing. I'm letting the weight of her head do the work. And this feels really good. And once I feel her occiput really start to slide back into my hands, the next step is like just a really gentle suggestion of a spread opening. Almost like my right hand is really gently pulling up toward her right ear and my left hand really gently pulling up toward her left ear. It's really subtle. But that gets a nice little stretch deep into the occiput. Some people say doing craniosacral therapy that you're actually stretching the tentorium cerebelli. I don't know if I am or am not, but I do know this feels really good. So it's relaxing and I open up that cranial base. And that's how we approach the upper cervical spine without any thrust at all. Nice and gentle, suitable for people with small frames or bone density issues or vascular issues. Thanks, Linda.
Thank you.
Thank you.